Welcome back to Pace Immigration, paceimmigration.com, talking once again with immigration lawyer Michael O'Rourke. Michael, good to see you.
Hey, Sean, how's it going?
It's going very well, thank you. Talking a quick update here, really. It's Canada announces immigration stream for health workers, and I think we're going to be doing a lot of quick updates as things go along because Canada is not short of new announcements when it comes to immigration streams, and it can be a little bit difficult to keep them straight, even though they might be beneficial to immigrants out there, and we want to tell them about them. But here we have Canada announces immigration stream for health workers. I don't think it's a secret for anyone that Googles Canadian news or Canadian healthcare and sees that there is a staffing shortage in hospitals, amongst other places in the healthcare sector. I've got a quote here from Immigration Minister Sean Fraser. Today's announcement, this was last week, will facilitate, fast track, and streamline permanent residency applications and help improve health workforce recruitment efforts by bringing more qualified health professionals into Canada. And what that announcement was about was that they're adding a stream, a healthcare stream, to the Express Entry program. So after that long preamble, Michael, maybe I'll let you briefly explain what the Express Entry program is in a nutshell and how this healthcare stream fits into it.
Sure. So, as part of the newest policy announcement, the immigration minister, Sean Fraser, is adding a new track or a new emphasis within Express Entry. Express Entry is the Canadian points-based system to identify potential permanent residence applicants and assess their credentials, assess how competitive they would be in the Canadian workforce, and extend invitations to apply for permanent residence. So it's our main route to get to permanent residence for economic immigrants.
Right. And the points that are applied, I mean, you get so many points depending on your age, you get points depending on your language ability. In this healthcare stream now, and it's not just healthcare, there are other industries that are now being put into the Express Entry program. But in this healthcare stream, I suppose what they're doing is they're saying, okay, out of the number of Express Entry people that we take, we've got this healthcare number we want to reach, and then we're going to judge you based on that against your colleagues, I suppose.
Well, it's judged against people who are in the pool who've already made a profile. So, as you said, they will assess different points for degree level, any experience in Canada, language skills in English or French, and more or less how you rank against other people in the pool. So, age is a big factor, family. What you're trying to get to is the magical points number of to be competitive in the pool and to be chosen in the next round of draws. So a profile is good for 12 months, but we never know what level of points is necessary to actually be drawn in the pool and to receive an invitation to apply.
Okay, maybe we can do another video sometime about how to get a leg up inside that Express Entry pool because the points matter. Let's face it. I mean,
Yeah.
depending on where you can get points from, it's going to matter of whether or not you're going to get that draw. And if you are in that draw, if you are a winner of that draw, so to speak, you get an invitation to apply for permanent residency. And we have here the announcement by the government was by July 5th, 2023, which is actually today. You're watching this probably in the future on YouTube. But by July 5th, 2023, 2,000 healthcare workers will have received invitations to apply for permanent residency in Canada. It includes foreign doctors, nurses, dentists, pharmacists, physiotherapists, and optometrists. That's not a complete list. It just includes those. Michael, 2,000 people sounds like a lot, but again, it's an invitation to apply, so that doesn't necessarily translate into real numbers.
No, it doesn't. So some people who have profiles in the system may not choose to apply. They might let it lapse and then their invitation goes stale. Once they do receive this invitation and say that they're successful in making a PR application, then they have to go through the whole gauntlet of having their credentials recognized and getting licensed by either one of the federal colleges of physicians or getting the province to recognize their credentials and give them a license to practice their profession in the province. And that can be a huge years-long barrier to somebody actually working in this field.
Okay, so we're telling people right now, or at least the government of Canada is telling people right now, that they need healthcare workers. If you are a healthcare worker, please apply, is what they're saying, obviously, because they're sending out 2,000 invitations to apply, and that's only right now. They said it's going to continue in the months ahead. How does that square then with the credential stuff? Do you foresee more of a federally mandated thing, or trying to bring the provinces together to speed up that part of the problem?
Well, the federal government is trying to get the provinces on board, but the provinces have exclusive jurisdiction in terms of licensing for professionals. So who knows?
Yeah.
If Sean Fraser starts playing Kumbaya and gets all of the provinces and territories to agree that we need to do something, maybe something will happen in a year or so, maybe more, but it's hard to say because I think the provinces jealously guard this power, and they have been historically very slow on recognizing foreign licenses and actually getting foreign professionals into open jobs.
Okay, so what's the upshot of this then for us? Because obviously Pace Law Firm is interested in helping people come to Canada. If someone is out there and is interested in coming to Canada, would you still, recommend this route for someone who has that in their background anyway, and letting the chips fall where they may?
Sure, I would, because it is a way and hopefully a fast way into at least permanent resident status. Anybody who's seriously interested in this could begin the credentials licensing or credentials recognition process for their particular field. Also, something we should note, this is a permanent residence program. It will not allow anybody to come to Canada and work temporarily as a temporary foreign worker on a work permit prior to landing as a permanent resident. So there are options for that. Some provincial colleges and licensing authorities might have temporary licenses so that you could work in your profession while the process is moving forward. But again, it's really an individualized analysis, so it'll depend on the person's background, what their goals are, what sort of lead time they'll need to come to Canada, whether they'll be coming as a permanent resident under this express entry invitation to apply. I'm just trying, Sean, to work in "it depends," which is my favorite phrase.
That's Michael's phrase with me.
It depends.
And of course, you're right. It does depend. It is a personalized thing. But I think the fact that it's an invitation to apply for permanent residency and it's a chance to get permanent residency pretty much right off the bat is a pretty big lure for people that do want to come to Canada to enjoy a Canadian lifestyle.
Yes.
And then they can take care of the occupation stuff as it goes along. You can help with all of this. You can help with the express entry profile and getting their ducks in a row with their paperwork and everything.
Sure. We can help with any sort of permanent residence application through the express entry program, or we can help with temporary work permit programs as well. We're happy to have a consultation where we look at the totality of the circumstances, figure out the best way to come to Canada, maybe leveraging this process first, maybe applying once the person is already here. We're happy to help in any way we can.
Fantastic. Thanks, Michael. So Canada announces immigration stream for health workers. If you are a healthcare worker out there and you want to talk about coming to Canada, Michael O'Rourke and the people at Pace Immigration are here for you. O'Rourke@pacelawfirm.com. Michael, thanks. We'll talk to you soon.
Sounds great, Sean. Thank you. Take care.
Bye-bye.
Bye-bye.